Why do osteoporosis drugs have surprising cellular side effects? Imagine a medication that helps strengthen your bones but also influences other parts of your body in unexpected ways. That's because osteoporosis drugs, while designed to improve bone health, often interact with complex cellular systems that extend beyond bones. Bones are constantly changing through a process called remodeling, which involves two main types of cells. Osteoclasts break down old or damaged bone, and osteoblasts build new bone. These cells don't work in isolation. They communicate with other cells and systems in the body, making the effects of drugs more widespread than just bone. Many osteoporosis drugs work by either slowing down osteoclast activity or stimulating osteoblasts. For example, Bisphosphonates and Denosumab are anti-resorptive drugs that reduce bone loss by targeting osteoclasts. But osteoclasts are closely related to immune cells, so suppressing them can sometimes lead to increased risks of infections or rare conditions like osteonecrosis of the jaw, where the jawbone starts to die due to poor blood flow. There are also reports of atypical femur fractures, which are unusual breaks in the thigh bone that can occur with long-term use. These side effects are surprising because they aren't directly about making bones stronger but involve how these drugs influence cell survival and tissue repair elsewhere in the body. On the other hand, anabolic drugs like teriparatide and abaloparatide stimulate bone growth by acting on osteoblasts. While they promote new bone formation, they can also affect other cells that share similar signaling pathways. This can lead to side effects such as increased calcium levels in the blood, which might cause symptoms like nausea or muscle weakness. In rare cases, animal studies have suggested a potential increased risk of certain cancers, although these findings are not conclusive for humans. Because these drugs influence pathways used in many tissues, their effects can be unpredictable. Some medications, like selective estrogen receptor modulators or SERMs, mimic or block estrogen's effects. Estrogen plays a role in maintaining bone density, but it also influences other organs. When these drugs are used, they can cause side effects like blood clots, hot flashes, or fluid retention. These happen because estrogen receptors are found throughout the body, not just in bones, so altering their activity can impact blood vessels, skin, and other tissues. Recent research is exploring how drugs that target aging processes, such as those affecting cellular aging or senescence, might influence bone health. These treatments can impact stem cells and immune cells, which are involved in tissue repair and immune response. While this research holds promise, it also raises the possibility of unexpected effects because these pathways are involved in many bodily functions. In summary, osteoporosis drugs can have surprising cellular side effects because they interact with intricate networks of cells and signaling pathways that extend beyond bones. These effects are a natural consequence of how interconnected our body systems are. That's why careful monitoring and personalized treatment plans are essential when managing osteoporosis. Always consult healthcare professionals to understand the benefits and risks of any medication, as individual responses can vary widely.